Re-examining healthcare, corporate heavyweights, Amazon, J.P. Morgan, and Berkshire Hathaway unveiling plans this past week to form an independent healthcare company for their U.S. employees. This joint venture aims to reduce healthcare costs while improving care. Berkshire Hathaway CEO and chairman Warren Buffett said that this is the current state of healthcare. Here's his quote: "The ballooning costs of healthcare act as a hungry tapeworm on the American economy." Joining me right now is the executive advisor, former chairman and CEO, and president of the Cleveland Clinic, Dr. Toby Cosgrove. Dr. Toby Cosgrove, it's a pleasure to see you.
Good morning, Maria.
Thank you so much for joining us. What's your take on this new company that they're forming?
Well, I'm delighted to see that three people who I respect enormously and who have great intellect and great swat in the U.S. economy are weighing in on healthcare. We certainly need to do this. We need to take costs down across the entire organization, entire business.
I mean, I would think that when you have one big company coming up with competitive pricing, it sort of shakes up the whole market, because we know this is going to be for their employees. If you don't work for Amazon, Berkshire Hathaway, or J.P. Morgan, you don't have access. But does it have longer legs than just those three companies?
I think we'll have to wait and see. I don't think we know yet how successful they're going to be. There's been attempts to do this in the past that have not been terrifically successful. But if you stop and think about it, the U.S. economy, the U.S. healthcare payment is really broken into two groups: the government pay and then the private pay. And the government has been pushing very hard in trying to reduce cost. I'm glad to see that the private payers, the insurers, are beginning to enter into this.
Yeah, I mean, you know, you would think that because of that competitive situation, prices come down. But what is the answer to getting drug prices down? Well, I mean, the president in his State of the Union this week talked about this as one of his priorities. He delivered his inaugural State of the Union address on Tuesday. He spoke on one of his top health care commitments this year. Listen to this.
One of my greatest priorities is to reduce the price of prescription drugs. I have directed my administration to make fixing the injustice of high drug prices one of my top priorities for the year.
That was a surprise in the State of the Union, by the way. Can he do that?
Well, it remains to be seen. I mean, first of all, you have to see that drug prices are going up enormously. Our pharmaceutical bill went up 19% last year,
wow.
And there are problems with generics that have raised prices on things like EpiPen 500%, and that is almost unconscionable in my mind.
Totally.
And then the prescription drugs have gone up 10% a year with some regularity, which is great, a lot more than inflation rate. And so it's very difficult to maintain this. And the government, frankly, does not negotiate for Medicare drug pricing.
So is that the issue? The government's not negotiating. You need negotiation, you need competition. When we've had on Heather Bresch, the CEO of Mylan Labs, she says it's the system's fault. It's because you got to give to the pharmacy benefit managers. You got to give and take to this guy, that guy, this guy. And people don't recognize that they're not the only problem in terms of raising prices. What do you say?
Well, there's a lot of problems here. For example, we pay much higher prices in the United States than the rest of the world. So we are essentially subsidizing the development of new drugs for the entire rest of the world. You see maybe a 10% or 100% difference in prices of drugs and devices. A heart valve in the United States that sells for $3,000 will sell for $300 in Egypt. The same sort of thing for $80,000 or $80,000 for a hepatitis C drug in the United States will be $800 in Egypt. So we are subsidizing the development of drugs for the rest of the world.
Let me ask you, Toby, before you go, at your core, you are a heart surgeon. I mean, you're all this important person, and you're an expert on all this stuff, healthcare. You built this incredible institution, the Cleveland Clinic, made it the best in the world. But let me ask you your core in terms of heart disease. Where are we in the fight? And what do you say in terms of what has taken place as a result of this innovation that we've seen in terms of heart disease being the biggest killer still?
Well, now it's great to see the incidence of death from heart disease come steadily down over the last several years. And I think it's been a multitude of things. It's been better understanding of the foods we eat. It's been drugs, cholesterol-lowering drugs. It's been better understanding of management of hypertension. There's been a whole series of things, but I'm delighted to see that it continues to decrease the incidence of deaths from heart disease.
So, but it's still the #1 killer, isn't it?
It's still just ahead of cancer.
Wow. Dr. Toby Cosgrove, always a pleasure. Thank you so much.